ever pondered the question, what is diabetes and how does it impact the body? This complex condition, also known as diabetes mellitus, is a metabolic disorder characterized by prolonged high blood sugar levels. It's a multifaceted health issue with several types and accompanying symptoms. Today, we're delving into the world of diabetes. First up, type 1 diabetes. This type emerges when the immune system, in a tragic case of mistaken identity, assaults and destroys the insulin-producing beta cells in the pancreas. The result? Little to no insulin production. It's a type that usually surfaces in children and young adults. Moving on to the most common culprit, type 2 diabetes. This type is responsible for approximately 90% of all diabetes cases and typically develops in adults. It's linked with insulin resistance, a scenario where the body's cells become unresponsive to insulin, and the pancreas may not produce enough insulin to counteract this resistance. Another form of this condition is gestational diabetes, which occurs during pregnancy and usually resolves after childbirth. However, it's worth noting that women who experience gestational diabetes are at a higher risk of developing type 2 diabetes later in life. There are also less common types of diabetes, such as monogenic diabetes, which is caused by mutations in a single gene, and secondary diabetes, which results from other medical conditions or medications. So, how does one recognize diabetes? Common symptoms include increased thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, and slow healing of wounds. Now that we understand the types and symptoms, the question arises, how does one manage diabetes? The answer lies in a combination of medication, lifestyle modifications, and regular blood sugar level monitoring. Medications may include insulin injections or oral medications. Lifestyle modifications often involve dietary changes, regular exercise, and weight management. However, it's crucial to remember that untreated or poorly managed diabetes can lead to severe complications. These may include cardiovascular disease, kidney disease, nerve damage, and eye problems. In summary, diabetes is a complex metabolic disorder with various types and symptoms. It requires careful management to avoid serious health complications. So, whether it's type 1, type 2, or gestational diabetes, understanding the condition is the first step towards effective management. Remember, knowledge is power when it comes to health.